most of you know that I am Monique with the Relay for Life. I'm the volunteer event lead, and I have here with me today is Eunice Hostetter. She is with the Cancer Action Network, and she's going to tell us a little bit about what that means.
Hi, I'm so glad that you invited me to come on today, Monique. I would have loved to have been there in person for your relay, but as we know, the pandemic has changed everything. But I'm really pleased that you guys are all carrying on with your relay, even though it's virtual. We're not getting wet, and I guess that's a plus. But yeah, I'm with ACS Cancer Action Network. I've also done a lot of volunteer work for ACS itself, but about 15, 16 years ago, I started volunteering for CAN, and CAN, as we call it, Cancer Action Network, is the sister organization of ACS. And basically our purpose is to make sure that every elected official makes cancer a priority. And it takes a lot of volunteers to make that happen. So I'm really happy to be here today to talk with you about that. So I'll turn it back to you and answer any questions you might have.
So what kind of things do you do to make sure that the elected officials are making cancer research a priority and, making sure that it's still forefront of everybody's minds?
Okay. Well, we fight really hard for cancer research. That's one of the number one things, because we know that cures and better treatments and better diagnostic things won't happen unless research is funded. So that's definitely a priority for us. But in addition to that, there's a lot of legislation that needs our support. Things like, tobacco. We were very effective last year getting tobacco 21 passed through the state so that kids can't go buy cigarettes anymore. They have to be 21. And we've done a lot of work to educate people about the negative effects of vaping. So we do a lot of advocacy that way. But basically, we try on every issue that is related to cancer to make sure that our lawmakers have us in mind when they're making decisions about the budget. And they listen to us. They have a lot of people advocating for various things, not all good, but we're pretty powerful. And that's been demonstrated both in the state, in Olympia with our lawmakers, as well as at the national level. Every year in September, we have a lobby day, and usually we have a team of people, about 12 people that represent all of our congressional districts in Washington state. And we spend a couple days in training, and then we hit the hill. We have personal meetings, and we have a list of things that we're asking them to support. And we've been very successful at that. This year with the pandemic, it's making fighting for cancer causes a lot more difficult because we cannot go in person. We have to do more in a virtual sense, including our lobby day this year. And we're really trying to figure out how that's going to work. We do a lot through the year by email, by phone. We go to town hall meetings and talk with our legislatures. We really like, and it's interesting, they often look to us as being really knowledgeable sources of information. When it came to things like support, for the Affordable Care Act, for access, giving more people access to insurance plans, et cetera, they often contacted us and wanted to get our opinion on things and what were the important things. And so we really try to build that relationship to influence change. And, it's interesting because we're all volunteers, but ACS CAN trains us and they empower us to deliver that message on behalf of all cancer patients. And it's pretty amazing.
I know.
We'd like more people to help us.
I watch for those emails when they come out, and it only takes seconds to fill it out and send it off to the elected officials and make sure that and I did a dance on Christmas last year when I heard that minors could no longer buy cigarettes.
Right. Yeah, I think you were referring to our action alerts, and that's one of the really cool things I think that we do that really enables everybody's voice to be heard. Basically, if people haven't done it before, what it means is if they join CAN, they would be on our distribution list to receive a pre-formatted message on whatever the issue is. And we don't do it, we don't exceed, I think, people's, we're not blasting everybody's
No.
email box. It's really on just really important things where we need the attention and action. It might be when a bill's coming up for a vote and we know it's really close. So you get this little message in your email box, and there's no penalty if you ignore it. Sometimes people are busy, and we know that, but it's pre-formatted. And what I love is because we have addresses in our system, we know who your representative is. And not everybody knows their representative's, email address, but it's all pre-formatted. There's a message. You can add to it if you want, but you don't have to. But trust me, your voice is heard. It has made a huge, huge difference.
I've had a response, so that's nice. It's there.
Yeah.
So speaking of COVID and having it change everything, so what's going on with ACS or with CAN and
it's COVID has affected our whole world, really. I mean, our economy, our healthcare, everything. Schools shut down. So, we're having to, kind of change the way we do things, but it's a particular challenge for those of us that are dedicated to fighting cancer. For one thing, cancer patients have had treatments delayed. Those people that are concerned about, maybe there's something they feel in their breast and they haven't been able to get into a mammogram right away. I talked with somebody today whose mammogram was being delayed. She was, over a year out. She's had cancer before and she tries to get in. And there was a backlog. So she actually went to another healthcare center and she wasn't quite pleased. She wished she had waited. But that's the kind of thing that's happening. They kind of had to stop everything. So the queue built up. That's, they're addressing that now. But, and then the worst thing is that cancer patients, unfortunately, are more likely to die if they get COVID. And so that's a huge concern. So the American Cancer Society and Cancer Action Network are very active. They've been very involved with the stimulus bills, trying to get things in place that will help support cancer patients and their families. And that work is in progress. There's currently bills underway that we have people in Washington, D.C. that are weighing in on that. The other thing that I'm really concerned about, I mentioned this is a challenge to us individually in fighting it, but it's also a huge challenge to our organization. Just as it's hit many businesses, et cetera, it's really hit ACS really hard. We're really dependent upon public donations and events like relays, other fundraising events, so that we have the funds to support research, programs, Hope Lodges, those kinds of things. And we've been devastated, really hard hit. And I just saw today a press release that 1,000 employees have been released from ACS. And these are people that are, nobody's sloughing. I mean, we need these people. And 30% of the budget has been cut. So there is a real need for us to continue with fundraising. It's hard when we don't have, live events. But we're just going to have to work harder and harder to get our message across to, our elected officials. We need to stay engaged. I think if we can stay engaged and just everybody make a commitment to step up to it, we'll get through this. Cancer hasn't stopped during this pandemic, and I can promise you I'm not going to stop, and I know you're not either. So we're in this together.
So I see you're wearing a purple shirt.
I am.
So that means you're a survivor.
Yes, 17. Yeah, 17. The end of April.
Wow.
Yeah. And I really give credit to the research. And there's been so many advances since I went through treatment. My treatment today would be quite different. Maybe a little bit better. And I feel very grateful to be here. And I feel so committed to this cause. Ever since I found out that I could make a difference with ACS and with Cancer Action Network, I couldn't not do it. And I hope other people will continue to join us because it's everybody's story, everybody's voice. The community you're in, the impact can be a good thing.
Yeah.
So one thing I would like to do is to and I know you guys are all busy with Relay right now, and I don't want to detract from your fundraising for that, but I would like to kind of circle back and maybe have something on your website that we could like maybe focus on more in the months ahead.
Sure.
And that is something called Lights of Hope. And you kind of see my display a little bit here. We've done this, some of the relayers will be familiar with this because we have actually promoted this every year for the last 10 years, where we have sold Lights of Hope bags that for $10 you can do a bag that's dedicated to somebody that you're remembering, you're honoring, supporting, that's been touched by cancer. And we've in the past taken those bags. Last year we had 40,000 of them at the Lincoln Memorial Reflecting Pool in DC. I mean, talk about an amazing event. And many lawmakers will come there. Okay, so with that $10, you not only get the bag, but you get a year's membership in CAN. Well, this year we're not going to DC because of the pandemic, but we want to get our message across. And so what we will be doing is a virtual Lights of Hope ceremony. It will be live stream. All 50 states and territories and thousands of communities will be doing displays of Lights of Hope. Some people will have a central area where they'll do it. Other people will do it in their driveway or their deck, wherever. And we will have all of those visuals integrated and be part of this live stream. And in many cases, we're going to get people to join us, and maybe even some lawmakers, and we will make sure that this is distributed to their offices because we want them to know the impact of cancer across the country. And I was really disappointed at first that we wouldn't be doing this because it's been such an awesome thing. But actually, I think there's some real value in the approach we're taking by pivoting, if you will, to this approach. Instead of 12 people from this state going to DC,
you have the whole state.
Exactly. We can involve and make it more personal for everybody to honor that person in their life. And just maybe by September, we can actually do this in person. Maybe we'll be past this time where, we have some restrictions. I'm hoping, so I would love to, I would love to see an event like this in Skagit somewhere.
Oh, I think Skagit can make it happen because we're not having our real webinar either this year. Right now, we have a bunch of virtual ones, which is great. But we'll post the information in the comments, and we'll make sure we get the info out there to our relayers.
That'd be great. Also, one thing I'd like to add is a number of people signed up for CAN and gave me information for Lights of Hope bags at the Skagit kickoff. And I will have those bags. I'm working on designing them, and people can do their own. I can send some bags to you if you want.
We have that.
Oh, great, perfect. But for the people that gave me names, I know there was one woman that gave me 5 names, and I will have her bags all done and give them to you for display, whatever, we're really flexible about what people want to do. We just want the inclusion because I think it can be a very powerful message. And we know that everybody's going to be looking at budgets to cut, and we don't want them to cut cancer research or programs that will benefit our community.
Absolutely. Well, thank you so much, Eunice, for your time. I really appreciate
it. You're welcome.
Had a struggle the last couple of weeks, and we're just glad you made it on here.
Well, thank you. I really appreciate it. And go Skagit. You guys rock.
Thank you.
Okay.